Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 briefing with Montgomery County Executive Mark Elrich. I'm Lana Pagelli, your Hispanic Public Information Officer for Montgomery County Government. And also joining us today, as usual, is Dr. Travis Gales, our Health Officer, and Dr. Earl Stoddard, who is the Director of our Office of Emergency Management and Homeland Security. Now, for those of you participating, remember, reporters, to ask permission to record using the chat. And also, when you're ready to pose your questions, do ask for permission as well. And with that being said, let's get started. Mr. County Executive.
Good afternoon, everybody. Chilly day today. I want to thank everyone for joining us, and I hope you had an enjoyable and a safe Thanksgiving. I know mine was safe because I didn't go anywhere and I didn't have anybody over. And I hope everybody basically followed the same set of guidelines. We're continuing to brace ourselves for the projected increase in COVID cases. The second wave or third wave, depending on how you look at it, is certainly upon us. Unfortunately, the number of cases in our county, around the state and around the country, continue to trend in the absolutely wrong direction. So far this week, our case count per day has remained high. Yesterday, our case count was 505, and today it's 254. Test positivity in the county has gone up to 5.6, which is no longer a low rating, and our cases per 100,000 is at 31. I remember the good old days when being over 10 was considered to be a high rate of transmission. So keep that in mind. We're at 31. This is up sharply from 1 week ago. At our last media briefing, back then the test positivity was 4.7 and our cases per 100,000 stood at 27.9. In context, most counties in the state have positivity that's higher than Montgomery County, and most counties in the state, I believe, now are over 30 cases per 100,000. So it's a Montgomery County problem, but it's a problem throughout the state. Testing volume at the county-sponsored testing sites continues to be high. Last week, we tested a little over 12,600 people. Yesterday, we tested 2,700 people. This high volume level of testing is causing delays in people receiving their results. This is not, again, an issue that only exists in Montgomery County. This is happening all over the place because the labs are trying to work through the backlog from the Thanksgiving rush. Clearly, they are not equipped to deal with this volume of testing in the normal course of what labs are set up to do. So this continues to be a problem. We're asking people to be patient. The labs are working as fast as they can to get results out. The labs are open 7 days a week. This delay in getting results should not come as a surprise. We did have a record number of people getting tested before travel, and the labs really have been challenged to keep up with the volume. We expect that volume to remain high as people continue to get tested following the Thanksgiving holiday. Hopefully more people listen to us than not, but I don't know. If you didn't go anywhere and you stayed home and had a quiet dinner with the people you're around all the time, you're probably okay. If you were someplace else, we don't know. With the rapid rise in cases, we're closely monitoring our hospitals. Yesterday, the governor talked about the need for additional healthcare workers to support the growing needs for the hospital staff. And I appreciate the governor talking about the need to address hospital capacity. Montgomery County, we have a very good partnership with the hospitals here, and Dr. Gales and Dr. Stoddard have been working directly with the hospitals. Over the last few days, about 73% of our hospital beds have been in use, which means that we are approximately 25% away from reaching capacity. But before anybody gets too comfortable with that, we were told in a meeting that if our hospitals have capacity and hospitals in neighboring jurisdictions run above their capacity, we may well receive patients from the other counties. So the filling of our hospital may not only depend on what happens in Montgomery County, but it could be affected by what happens outside of Montgomery County. And remember, a lot of the other counties either have very, very small or just small hospitals and do not have the kind of capacity that we have in the National Capital Region. These numbers are alarming, and we're just not going to wave the white flag and say our hospitals will fill up. We're not simply going to stand here and say there's a wave coming, dig your toes into the sand, and hope the wave doesn't move you. We're going to continue to do what we can do to minimize the full negative potential of this wave and what it could do to the county. It's our responsibility to prevent this from happening. And we are looking at every possible avenue to prevent our hospitals from filling up. And what that means is finding ways of keeping people from getting exposed and getting sick. The hospitals filling is merely a reflection of people getting sick and the COVID virus spreading in the community. And I've said this from the beginning, and I'm going to say it again now. Without vaccines widely spread and without treatments widely available, the only people who can stop the spread of this virus are us, our actions. That's it, folks. Either we do the things that keep people safe, or we get tired, we get lazy, we get frustrated, we let down our guard, and we make decisions that wind up exposing more people. I'm reminded of my childhood and the friendly bear who would come on TV every Saturday morning during the cartoons, and it was Smokey, and Smokey would say, only you can prevent forest fires. Well, in the case of COVID, only you can prevent the out of control spread of COVID. And we've got to keep hammering this message home. I'm concerned that people, they hear all this news about vaccines, and I'm excited about vaccines, but vaccines are going to come online slowly. They are not going to be widely available for a while. There was a story this morning that Maryland would get the first tranche of vaccines it would serve about half of its public health workers. And that doesn't include anybody else who needs to get vaccinated in highly exposed areas. So while it's good to be sitting in a place where we can see what the future is going to bring, the future is not here. And until it's here, everything we do either minimizes the spread of the virus or it maximizes the spread of the virus. So I am begging people, please be patient. Please listen to the guidance that we're trying to give you from our health officials, and be careful. And I'm as frustrated as you are. I miss everything that you miss, whether it's going to dinner or going to a concert. There's a lot we're not able to do that's totally normal. Walking into my daughter's house, I cannot do. We all are frustrated, but we need to get to a different place, and we need everybody in this county to pull together and work in the same direction. We're continuing to look at the data, and we're working with our neighboring counties. Rather than a blanket approach, we're looking at what actions we could take that would have the highest impact on case reduction. We could do this alone, but we really shouldn't. It would be less effective than if we could act in concert with others. Best of all, if we could act with the state. We are the National Capital Region, but I will do at the end of the day what I can to protect the people of Montgomery County, whether it means acting on our own or acting with others. At the same time, we continue to look at what it would take to open schools in a limited way. What we do to bring down the cases now, heading into this wave, will be effective to reduce positivity in the number of cases per 100,000. I hear a lot of people talk about what Dr. Fauci said about the importance of opening schools. I was so concerned that I actually went to the news articles to see what Dr. Fauci actually said. Unfortunately, the people who liked that part of the sentence left out the rest of what he said. And what he said was that reopening has to happen in a climate of low transmission, which is decidedly not where Maryland or most of the state or country is right now. So our path to dealing with the wave hopefully produces a longer-term reduction in cases and in case positivity, so we can consider more opportunities in our schools. I think a lot of us thought in the summer that we might be close. We had positivity under 5. Our cases per 100,000, so on a good day, we're down to around 5, but that evaporated as things opened up in the state more. All the work that was done to bring the caseloads throughout the state down began to unravel a little bit, and we are where we are right now, and we are not in the status of low positivity, low transmission. That said, this virus is going to spread rapidly. It's continuing to spread rapidly, and we cannot stop our fight or let our guard down. We must do everything we can to protect ourselves, our families, and our neighbors. So we are going to continue. I appreciate, your tolerance, and I understand that we've had to redefine many aspects of our lives, and we're going to continue to do that. So we need everyone to wear a mask, socially distance. Don't get too comfortable about staying in a room with other people for a prolonged period of time, because as you know, the CDC has made it clear that 6 feet really isn't enough if you're in a closed room. And the fact that the virus stays in the air longer than was originally thought. The longer you're in closed rooms with other people, the more potential there is for exposure. So please do everything we need to do. We've already had over 900 people in our county die from this virus. We don't need another 900 people to die. We need everyone to do their part to slow the spread. And so we're counting on you to continue to do what you've been doing, maintain the patience, keep an eye on the future, but live in the present and do what you need to do right now. Thank you.
Dr. Gales?
Good afternoon and happy Wednesday. Much like the county executive mentioned, I hope you all had a good holiday and enjoyed at least one item that was full of calories and full of good flavor. Now, moving forward in terms of our briefing this week, we continue to be concerned about the level of community transmission where we are, and we continue to be concerned about the potential trends and increases in cases that we could see and likely are to see secondary to what was noticed to be significant holiday travel across the country. We are also, thankful for the guidance that and the efforts that the governor provided yesterday in terms of efforts to increase and support hospital capacity. It's important to note that a number of those strategies we've had in place in Montgomery County for a while, including utilizing our school health workforce in different components of our pandemic response, including contact tracing, are supporting our call center, as well as providing support to our testing apparatus that has grown significantly. In addition, we also had previously reached out to a number of places, including the University of Maryland, to utilize their student nurses to be able to provide support. And if I recall correctly, we do have some of those students who will be training this week to actually support some of our testing programs and platforms. And the last thing I'll mention related to testing before checking off a couple of other points is to highlight is, yes, there are delays in test results, and that is secondary to the labs absorbing significant capacity. It's important. I know that a lot of the story is, and I share your frustration, we'd love to get those results back quickly. The labs are overstretched right now due to the increased testing demand, in large part due to a large number of people who were tested before the holidays. But the reality is we're here because we have record levels of community transmission and record levels of cases, and we can't forget that. We are continuing to work to diversify the different labs that we utilize to help absorb some of that increased surge. But the fact of the matter is every lab right now across the country, including the state's public health lab, is having extensions in terms of the time from when the specimens collected to when the results are reported. Now, while we do appreciate the guidance that was provided from the state yesterday, there was a noticeable absence of guidance related to keeping people out of the hospital. And so certainly we want to do everything we can and continue to work with our hospital partners who've been fantastic and have great, robust surge plans in place from the early parts of the pandemic. But we still have a whole lot of tools available that are evidence-based and scientific proven to prevent the spread and the transmission of COVID-19. And I think it's incumbent upon us to continue to discuss how we can deploy those strategies to minimize the risk of exposure for individuals and minimize transmission so that we're not having to see such significant increases in hospital volume. Because let's not forget, hospitals aren't just sites where COVID patients are taken care of. There's a whole host of other health conditions that require hospitalization and require utilization of the expertise within those settings. And it's important, again, for us to do everything we can to keep people healthy and keep them safe and to keep them from having to utilize the hospital to free up space, not only for the sickest of sickest patients who have COVID-19, but those who also experience other health conditions. And just briefly, lastly, I want to highlight 2 points. We are continuing to await further information from the vaccine perspective. The committee that oversees immunization practices did release a recommendation yesterday that was voted on majority rule that said that those who should get the first set of vaccines in the 1A category are healthcare workers and residents of long-term care facilities. We expect that there will be further guidelines released about the safety and efficacy of the vaccines, as well as in anticipation of the hearing next week on December 10th that will review the EUA application of at least one of those candidate vaccines. And the last thing I'll highlight that was released this morning is that the CDC did update its guidelines related to the time period within which an individual is recommended to quarantine to 7 and 10 days respectively. And while the quarantine period has decreased from 14 days, the expectation of needing to quarantine hasn't changed. And so we hope that people don't take that as a sense of like, oh, I'm free to still go out and do everything. No, if you are exposed, you still are required to quarantine and get follow-up testing. That has not changed. I'll stop there, but as always, happy to answer any questions you all may have. Thank you.
Thank you, Dr. Gales. Dr. Stoddard?
Good afternoon, and thank you for coming back to our media briefing. I want to talk a bit about enforcement because I know this has been something that's been much discussed across the state as well. Over the last week or so, we've ramped up our enforcement in partnership with the Maryland State Police. This past week, we've had, typically we have had our Health and Human Services and Alcohol Beverage Services inspectors out, but they've actually been joined in their efforts by Department of Transportation, Department of Environmental Protection, Permitting Services, Housing Community Affairs, and Animal Services inspectors. In addition, our Montgomery County Police Department and Maryland State Police have been coordinating some of those efforts. Over the last week or so, we visited more than 100 different businesses, including not just our restaurants, but our retailers and other establishments, and we've issued 0 citations. And I think that the key point there is that the reason we issued 0 citations is because we found largely people were complying with the executive order, both for the governor's order and for the county. And so I think the key point here is that enforcement is an important tool, but we are not going to enforce our way out of this current surge. We will continue to ramp up those efforts, but simply put, we're not seeing this egregious level of consistent violation when we're in our local businesses that tells us that there's some unsafe activity that's pervasive throughout all of them, and even pervasive within a few of them to the degree that we'd had to issue a citation. And so I think it's just really important to understand that, while we take enforcement very seriously and we'll continue to do so, we've issued more than 37 citations since the beginning of the pandemic. We've shown we're willing to do that. We've shut down businesses. We've got a couple businesses that are closed for extended periods of time because of their repeated violations. We've been on the forefront of this enforcement issue, but generally speaking, I think our businesses are doing a good job, and I don't think the surge that we're seeing now is because of some complacency within our business community that is driving it up. I think just there are just too many people who are infected and too many people inside various spaces for us to protect them under the current rules. I did want to add one piece of commentary to what Dr. Gales talked about, which is the testing delay. I think that the concern, I think that this is an important bellwether for us, is our concern is that, this testing delay because of a surge in volume can easily become if we think we are upset about a 7 to 10 day delay in test results, we'll be even more upset if that ultimately becomes a 7 to 10 day result in hospitalization bed availability or ventilator availability. And I think that's the thing that we're trying to actively prevent. I agree with Dr. Gales 100% that we support the governor's push to have additional surge capacity, but we can only surge the hospital and healthcare system so far. And bed 9,000 will result in a reduction of care relative to our current capacities. And I think we should be clear about that. And so we certainly should be trying to stretch our healthcare system and provide as much capacity as we can. But if we do nothing to prevent that capacity from being reached, there will be a lot of Marylanders who are not with us next year that would have been otherwise. And I think that's it for me.
All right, thank you, gentlemen, for the opening remarks. And now we transition to the Q&A portion of this press briefing. First questions from Chris Gordon, NBC4, for the county executive and also for Dr. Gales. Chris?
Thank you very much. I wanted to ask about the vaccination program for nursing homes and long-term care facilities. Is there any indication, what indication can you give us about the planning for that and the timing of that before employees and residents of nursing homes will have a vaccine or vaccinations available?
Well, I think the first part of the question is we're still awaiting to get that information. I think even the early estimates are that the first set of vaccines to be delivered will be approximately 5 to 6 million doses across the country. We don't have a full sense of how many will be delivered to the state. It's probably going to be somewhere between 250 and 300,000 in that first wave. And so the expectation is likely that a large portion of that would go towards healthcare workers who are on the front lines in COVID-related settings, more likely to be exposed to it in those settings and taking care of those patients. Now, there is a program and a partnership where nursing home facilities can partner with pharmacies to deliver the vaccine and administer that. And the state has offered that program. And in fact, all of our nursing home facilities have signed up to participate in that program in anticipation of when the volume will be sufficient to be able to start delivering to those different facilities. And this emphasizes the point that the county executive mentioned. The vaccine dissemination process will take some time. This is not something that will happen immediately. And when the first wave comes in December, then everyone will get it. The likelihood is that it will take 4 to 6 months to be able to get to the point where each of the priority groups are addressed before it will be opened up to the broader general public.
I think in terms of timing, the Pfizer EUA application will be heard by FDA on December 10th. Moderna's application will be heard on December 17th. And so obviously nothing will happen with either of those two vaccines until they have that hearing and are ultimately approved. Hopefully the Pfizer vaccine will ship, if it's approved after the 10th, and then the Moderna vaccine, we have not heard, I think, how many doses Moderna has ready to release. And we'll likely not hear that until their hearing is complete on the 17th. So hopefully by the end of the calendar year, we'll start to see people with vaccine in arms. As a reminder, it does require 2 doses, so you do not have complete immunity even until probably somewhere in the range of 2 weeks after the second dose. And so we're waiting for further guidance on that. But I think it's just clear we've got a little bit of time to go before people are going to effectively be vaccinated, and then once they're vaccinated, there's going to be a little more time before they have that immunity. So we have to keep up the fight until then.
Chris, did you have a question for the county executive?
I got hit on mute. I think all three of you addressed the frustration in the delays in getting test results. My son visited me for Thanksgiving from New York, and the minute I put him on the plane to return, I went and I got a test at one of the same-day private testing centers, the one on Democracy. 11:30 yesterday, I was tested. This morning when I woke up, and I had an email with the result that I'm negative for COVID. That's less than a 1-day turnaround. It seems like the county labs are the ones having the delays.
So let me clarify that. It's not the county labs having delays. This is every lab. As I mentioned, it's the state public health lab who's having an increase in late. It's private and commercial all across the board who aren't utilizing the Rapid platform. And we are working, in fact, as we've mentioned before, we're working with the state to utilize their pilot program to integrate and implement rapid testing into the larger protocol and platform that we distribute. But one of the challenges is also the technology continues to improve with the rapid test. And in many times there are requirements to have follow-up testing, particularly for asymptomatic individuals who need a follow-up PCR to confirm their result. And the reason why I want to emphasize that is, again, this is not something that's specific to Montgomery County. It's not something specific to the county testing apparatus. If you are getting tested from a private clinic or private provider, utilizing those same labs, you're going to have delays. And another point that I want to emphasize too is, if you've had an exposure, a negative test does not rule you out from the need to quarantine. It does not excuse you from that, because the CDC guidelines clearly say, and they've actually reported it now, they've updated, if you've had an exposure, you come into contact with someone who's tested positive, or you've had a known high-risk exposure, the expectation is you would still quarantine, and the new guidelines say 7 days if you've had a negative test and 10 days without a test.
Robert McCartney with the Washington Post, you have a question?
Yes, thank you. This is a question for either Dr. Gales or County Executive Elrich. I mean, given that the numbers are going in the wrong direction, and we're likely to see, I mean, everybody's saying we're likely to see things get even worse because of the Thanksgiving travel, why not, get much tighter? Why not impose another stay-at-home order? Or shut down bars and restaurants? You'd have to come up with extra money, I presume, to help the businesses get through. But with a vaccine, on the horizon, why not adopt much tougher restrictions now to get over this hump and save hundreds or thousands of lives?
I'll answer part of it. I mean, when we were, we've been more closed than most people have been. And the constant drumbeat we get with people is, you're not actually stopping me from going to the store, going to the restaurant. I'm going to X, Y, and Z. I'm going someplace else. And the county's not an island. If this was an island, if I was Taiwan, I would have locked this thing down in the beginning, and I would have stayed locked down until it burned itself out, which would have been probably 4 to 6 weeks if nobody was going out and seeing anybody, and we'd be mostly over and done with this. But that's not the direction that this country went. And other places that have done better than us, I think of my friends in San Francisco, where their conditions of control were much stricter than ours. They were able to do that. But if you've got a region that's not doing that, let alone a state that's not doing that, it's a problem. When we tried to act on the private schools, the governor promptly took away our ability to make decisions about private schools. So there's a lot of concern that, if we stray too far from where the governor is, that we could lose our own ability to do some of these things ourselves. And then we'd be stuck with the state's restrictions. So we're looking at this. You notice we rolled things back, and then a week later, other people rolled stuff back too. I continue to argue for a regional approach, so that even if I can't get the state to do it, if I could at least get a cluster of counties where we have pretty high cross jurisdictional people working in both places, traveling to both places, then I would feel really comfortable about doing this. But I fear that if I do it by myself, which we may well do some things by ourselves, but if we have to do it by ourselves, it's not going to be nearly as effective as if we could do this as a collective group of counties. I really do think, because there's so much mobility, that it's important to try to do things together. And nobody's immune to this. And I share Travis's concern that, in the wake of a surge, the governor talks about how we're going to deal with the hospitals. And those, if you look at the numbers, the projected numbers in the hospitals are pretty startling. I would have preferred a discussion about we're going to do whatever we can to minimize those cases. We're not going to stop it at this point because it's gotten beyond the stopping it point. But we could certainly bend it, just like we did in the beginning, where, we looked at if you look at the graphs of where other jurisdictions went in the country, when this took off and Maryland started following that same upward spiral, and then we put some things in place and our numbers started coming down. We did not go up the extreme peak. And the county had the same experience. We put, tougher guidelines in place and we were able to bend the curve that would have been an ugly curve. We could do that now if we all act together. And I hope the governor, if the numbers look bad at the end of this week, I hope he rethinks where he's been and decides that we really do need, for the next few weeks, just to put a lid on this thing so we can get to the day when there are going to be vaccines and all the other things we want. We're just not there yet.
I would just add to the county executive's remarks a point, and it reminds me of a point that he made in his opening statement about what are our priorities, where we want to go. Because even in the setting of record levels of cases and community transmission, much higher and approaching to higher levels than where we were the first time around, we continue to get bombarded with emails asking to open more things up or to lessen restrictions, or why are we have restrictions on certain things? Why can't we do this? Why can't we do that? And we understand that this is impacting people on an individual basis. But you would think in a setting where we're telling you that in the absence of further actions, the hospitals will run out of space and we may not have room to take care of people, that would resonate more. And it just simply hasn't. And I think it's one of the tough questions, for example, even in the setting of clear guidance that recommended that folks not travel over the Thanksgiving holiday, we had the busiest travel days we've had since the beginning of the year, in spite of the clear guidance, in spite of the increased numbers. So in addition to having the conversations on a higher level to talk about implementing those strategies, and I'm going to go, if you don't mind, Rob, I'm going to go back and take that statement because I think you laid it out very well in terms of the types of questions we should be thinking about. We also have to ask ourselves on a community level, what actions do we need to take to make sure that we keep our families safe and keep others safe? And we have to ask ourselves, what are the priorities? If we're going to try to get the number down, to be able to get to a lower level of community transmission, to open up schools and do those things, we may have to put some restrictions on other activities that we are not necessarily ready to do, to let go of. And I think those are the kinds of tough questions that we continue to think about on this side, but we also have to continue to ask and engage in discussion about on a community level as well.
Thank you, gentlemen. Rebecca Tan with the Washington Post has also questions for you, Dr. Gales.
Thank you, and thank you for having me. So we've seen COVID-related fatalities in Maryland rise in recent days and weeks, and we've also heard in recent days about some very tragic cases of children age 9 and age 1 dying. I'm wondering, Dr. Gales, whether you can talk a little bit more about the fatalities that we're seeing now. How are they similar or different from the deaths that we saw in the spring?
Well, you're right. The governor announced yesterday, unfortunately, we have seen multiple pediatric fatalities related to COVID in the recent past. And it resonates. One, any death is too much, but certainly when we think of it from that perspective, these are young kids. And that chips away at our belief that, if you're of a certain age and you get it, you're going to be entirely fine. We simply don't know. We also simply don't know what the full spectrum and scope of the long-term side effects are if an individual contracts COVID. So, we've got to continue to make sure we protect all ages. Now, in terms of fatalities in the early stages of the pandemic here in Montgomery County, we did have a significant percentage of our COVID-related fatalities tied to nursing home and long-term care type facilities. Our age distribution for COVID fatalities was skewed to older age groups, 50 and above. It was also heavily skewed to disproportionately impacting Black residents of the county. Fortunately, through the summer, we saw those fatalities drop significantly, where we were seeing significant periods of time where we didn't have any fatalities. And you're right, we've started to see that change a little bit, where we're starting to see a trickle of 2 or 3 a day here and there, which is troubling because, again, to a point that Dr. Stoddard has made in previous briefings, the fatalities tend to lag behind the increases in cases. So you first start to see the increase in cases in general in the community level, which we saw. Then the next phase is you start to see the hospital numbers go up because you start to see people develop more significant symptoms. You start to see individuals who are at risk of more severe outcomes becoming exposed. And then the third component that typically happens in the third wave is you do start to see those fatalities increase. So right now, they haven't jumped significantly for us. But we hope that we're not seeing them in the nursing homes, given that the work and the efforts that have been put there. But so far, we've not seen any of the pediatric-related cases within the jurisdiction. Most of our COVID-related fatalities continue to be individuals of older age brackets, in the older age brackets.
Do you have any follow-up, Rebecca? You good with that?
I do have a follow-up. I'm just wondering, again, on the contact tracing data, which I'm sort of obsessed with, Dr. Gales, as you know. Have you seen any
things to be obsessed with?
Have you seen any recent, clusters again tied to any type of individual, any type of event, behavior, or again, are we just seeing sort of unbridled community spread right now?
We are seeing, I don't know if unbridled is the right word, but we are seeing significant, overwhelming levels of community transmission that make it very difficult to pinpoint one specific venue. Now, that said, the data that we have received does suggest that there are a number of places that are at increased risk of having individuals who are COVID positive utilizing those spaces based upon their interviews. We've seen it now, and I know some folks like to focus just on family gatherings. Family gatherings are a small percentage of this. We see it in the percentage of folks who, based upon the type of work they do, they aren't able to telework and work at home. So they have to come out, and so they are exposed through their work sites because they're coming into contact with the general public or around others. We see it in, we've seen an increase in Dr. Stoddard, and I believe our last week's press briefing showed the data. We're seeing an increase of COVID positive cases having been in houses of worship. We continue to see it in indoor dining facilities, and other indoor areas as well. Now, there have been some instances where there have been specific outbreaks where we have investigated and attempted to contain. Recently, we've seen an increase in those related to youth sports activities, as evidenced by recent cases involving soccer and a number of other sports. And to a lesser degree, we've also seen it in our school settings as well as our child care facilities.
Got it. Thank you.
Thank you.
Can I
Caitlin?
add something to that for Rebecca? I just want to say, I'm really frustrated about the workplace issue and this whole notion, of the essential worker, the people who are out there. And we have lots of people working jobs, particularly in the immigrant community, who can't afford to be sick. Because if they're sick, they don't get any benefits. They start out without health care, and they're ineligible for unemployment. And so you literally have people out there having to make decisions. Am I going to drop on the job, or do I need to go in and do my job so I can make sure I can put bread on the table and pay rent? And this is one of the tragedies, I think, of this situation. And it shows, it's a real social justice issue. If you're going to call people essential, you ought to treat them like they're essential. If we're telling these people that you've got to go to work, or, if your employer is open because I deemed it essential and you're not going to get unemployment if you don't go to work, then you got to treat them like they matter. They deserve health insurance. They deserve coverage if they get sick so they can afford. If they're lucky, they get sick for 2 weeks and then go back to work and maybe they're immune to it the second time. But we refuse to treat them like essential workers. The word essential in relationship to these folks is totally lost on me, because if they were essential, you take care of them. If they're disposable, you don't worry about it. And I really think, if anything changes in this new administration, if we're going to rely on people to do jobs under dangerous circumstances for prolonged periods of time, you better treat them like they're human beings whose lives you value, not what we're doing right now. It is really frustrating when people tell you they know they're working with people who are sick, or people who are sick don't want to get tested because they don't want to be told they can't go to work. This should not be happening in a civilized society.
I may add to that. We hope also that that's reflected in the vaccine policy as well. And, we're hopeful that when we talk about the definition of essential worker, it isn't just defense contractors or other people that the federal government may deem essential. We hope that that also reflects the community level people who are essential to all of what we do. We all need to go to the grocery store. We all need to go to the gas station. There's all these things that we all need to do. And we hope that the categories the federal government develops reflect that level of essential.
Caitlin Peets with the Bethesda Beat has a question for the county executive. Caitlin.
Hi, County Executive. I have two questions, actually. First is just kind of a quick follow-up to something you were saying before. You were talking about how badly you want to develop a regional approach, to fighting COVID, and reinstating some restrictions. I'm curious how long you'll wait or work on developing that regional approach before, you would pull the trigger and do restrictions on your own.
Not much longer.
Okay.
Not much. We are already talking, and when we're ready to decide what we're going to do, we're going to do it. And people either will come along with us or they won't. But I really wish other folks would. We're not calling for closures. Just to be clear, much as I would like to go back to phase one, I'm not saying let's shut everything down. We're taking a very measured approach, looking at capacity, using contact tracing to refine notions of what activities are more at risk than other activities. We're in a lot better place scientifically than we were in the beginning, when the easiest thing to do was to shut everything down. So we will take a more measured approach, but we've got to do something.
Are you getting pushback or resistance from other regional leaders?
I wouldn't say pushback or resistance. I think there's just concern about local conditions, and some lingering discomfort about, are there consequences if we do this, that the governor could snatch our authority away from us? Because some people, we're not the only ones that have been more restrictive than the governor. We might be going we might be taking a step that's even a tad further than we've been right now. There are just a lot of other things at play. But, I feel when I go out in the community, I do get the crazy stuff, but by and large, most people think that we're doing what we should be doing to keep people safe, and they want us to do things to keep people safe. That's what I hear most of the time. And I'll tell you, because I'm surprised about how unanonymous I am. I go places with a face mask on, and I'm pretty sure I should be able to go someplace and not be recognized. And that's not what's happening. People pretty much know who I am, and most of what I get is positive. So, and they're not my friends. They're not, people I know who, maybe share perspectives. It's just random. And I really appreciate that. And I see it in people's behavior. So we'll do what we need to do. Hopefully other people will recognize they're looking at the same numbers we're looking at.
Okay, and separately, I had just one other question on a completely unrelated topic, but while we have you here, with this week's news about proposed WMATA budget cuts, there's been a lot of focus on the impact of that on DC residents, but obviously there will be a local effect if those were to happen and go through. Wondering how profound you think that effect would be, how problematic it is, and secondly, if you have any ideas of things you would do to bolster public transportation in Montgomery County if those budget cuts did go through?
Well, the challenge is going to be what you fill it with, because the metro is pretty much irreplaceable going into the district. And so if we were faced with, if people aren't using it, it's not just the cuts in the service, it's whether or not people are willing to use the service. I mean, they're worried. The cuts are real. COVID is real, and it shut things down. But even as things open back up, there's a concern that, am I going to get on a crowded metro train? Or am I not going to do that right now? My view is the federal government on all these things should have stepped up. I've said this before, I'll say it again. They put us in an insane position where we've got to choose between business success and human life. It's either you open more things up knowing you're going to increase the spread of the virus, or you keep things closed so that you control the spread of the virus, so that you damage businesses. And the federal government's got to recognize this and take jurisdictions out of this really just dark place that they put us into. There are no good choices. And we need the feds to I think, provide the kind of business support, whether it's to businesses or whether it's to metro systems, to be able to ensure that they have the ability to shut down and they can have workers stay home, and people don't have to worry about, are they going to have a business when this is over, and they're going to have a job when it's over, and am I going to be able to pay my bills? This is something the federal government, and only the federal government, has the capacity to do. And if we had done this earlier and people weren't so worried about work and all the insecurity that comes from not working, we would have been able to close things down quicker. We would have been able to hold them closed for a longer period of time if people had not feared for the loss of their livelihoods. That's a terrible situation to put people in. And hopefully the new president and the Congress, whoever it's made up of, looks at this situation and realizes this isn't red and it's not blue. I'm talking about support for businesses. So, this crosses all ideological and, party boundaries. They need to do something to make sure this economy recovers. And, we did it for Europe after World War II. We ought to do it for our own people now. That's what I would do.
Thank you, Mr. County Executive. We have one last question from Aviva Becky. She is with Silver Strips, which is the Blair High School newspaper.
Hi, thank you so much, Dr. Gales. I just wanted to go back to a bit of what you were talking about the impact on young people. Aside from fatalities, would you be able to just talk about COVID cases and also the mental health impact you've seen of the pandemic on younger people?
Well, that's a great question, and welcome, Aviva. And kudos to you for your starting your journalistic career early, and hope that continues to blossom in the future. Based upon the data, we did see an increase in the percentage of cases hitting young people in late July and August. And that was one of the big concerns that led us to provide the guidance we did around schools reopening. And was a significant concern because even, it's clear that children can spread the virus as effectively as adults can. And so as time has moved forward and the cases have increased, the number of young people getting COVID has increased as well. The percentage has changed as we've started to see it shift a little bit back to evening out with older populations, starting to see an increase in the number of cases there. But we are learning more that even though young folks are more likely to have less severe symptoms, they can still obviously develop severe symptoms and severe illness. There has been some data to suggest that not the ability to transmit, but the percentage of cases may be more in the 10 to 19-year-old groups versus the 0 to 10-year-olds, which has led to some of the guidance and recommendations we've put forward, as well as in other places where you've seen earlier younger kids come back to school first in terms of the earlier years of elementary school before the older kids have come back into place. So that's what we know from the COVID perspective. We have limited information related to how the vaccine responds in children, as they were not included in those early trials, and there's very limited information on that. So we're still gathering more facts to determine what that looks like and how that will apply to children. And in terms of the mental health side effects, broadly, we know that COVID, everything being closed down and the different permutations of that have had significant impacts on the broader community. But the concern is for young people, this is interrupting their daily routines, their lives. You know, I think of my 8-year-old niece who now has become an expert on COVID by virtue of what I do. So she asks lots of questions, but you know, they don't get to go to dance class anymore. That's her thing. And so, you know, that's her activity. And so we've had to come up with some different ideas how to keep her engaged. You know, it's the same component of, we know that, you know, young people who are used to playing sports and doing different activities, that's a significant interruption into their lives. And we're saying, you know, it's not wise to be around large groups of people. On the flip side, and let me add to that, is we know we have to do increased work on that. But I also want to emphasize that we had not the greatest infrastructure to deal with adolescent and pediatric behavioral health concerns before COVID. You know, we live in a state where there's significant absence of inpatient and outpatient beds to be able to address the behavioral health needs of children. And COVID has made that worse. And so that's a lot into your answer for a lot in terms of my answer to your question, because it's broad. We're still learning lots, and we're still trying to get a full handle on the true impact from the mental health perspective. But do understand that all of the guidance that has been put into place, contrary to what you might hear, is to keep you and your friends and your fellow students safe, as well as your families.
I'm going to add to your lengthy answer, because this is such an important question. You know, I have 2 young children, and obviously, you know, it's not just the education that has been taken from them. They've been exposed, and you know, it's not just my family, but, you know, in families across Montgomery County, there have been, you know, there's economic hardship. There is, you know, a fear that has been put into children because of COVID-19 and a fear of, you know, spending time with other people outside their family. Being done for public health reasons, that it's going to take time for us to both assess the long-term impacts as well as unwind some of those impacts. I know the school system is committed through their programming to do more mental health and wellness assessments of students. That's going to become a whole of society question. It's something we're certainly talking about in our recovery framework. We know that there's going to be, sort of independent of the decision to keep schools open or to close them. I think there's arguments on both sides of that issue. I think we would still have significant mental health issues, children, adults, and others. But there's going to be a long-lasting impact of COVID-19 that extends well beyond the time when the virus is the major threat. And I think that's important for us to understand too.
All right, thank you, everybody. It is 1:30, and we will go off the air right now on Facebook and also on County Cable Montgomery. Thank you, everybody, for participating. And
Thank you all for coming.
we'll see you next week. Have a great afternoon.
Montgomery County's upcoming primary election, which takes place on June